Okay, Mayor, you're unmuted.
Okay, great. So do we have, so we're all here, as far as callers, are there?
There are 32 attendees.
Okay, great. So thanks to all the participants and everybody who has called in today for this virtual town hall meeting. It's been 45 days since New Jersey recorded its first COVID-19 case, and I thought that today would be a good point at which to gather together with everybody who's been involved in Long Hill's pandemic response to recap the measures that have been taken to by the township, and then take questions and suggestions from the community, from all our residents. So, just kind of by way of history, what would become this COVID-19 task force? Most of its members are around the table. So what would become the COVID-19 task force had its first meeting on Friday, March 6th, and that was just 2 days after the first positive case was recorded in New Jersey. So the task force was officially recognised by the Township Committee on March 11th by unanimous vote, and at the same meeting, the Township Committee released funds so that the task force could complete purchase of various items, including 4 UVC sterilisation units and other PPE supplies as needed and as they became available. So this action enabled the task force to access supplies of much needed PPE immediately that its members became aware of them, and it has led to the very favourable position that we find ourselves in today regarding supply. So it seems a long time ago, but that evening of the 11th, when we had our Township Committee meeting, really was the turning point of the crisis for New Jersey and indeed for the country. As we were conducting that meeting, news came trickling in about the NBA closing its season, universities closing their doors and starting online classes, and the United States being stopping flights coming in from overseas. So over the next few days, as we all know, the reaction to the crisis unfolded fairly rapidly, really bringing us to the point where we are today. So the members of the Long Hill Township Committee, the township administration, and the heads of its departments and volunteer agencies really should be they recognise the importance of the threat of COVID-19 very early on, and their swift and decisive action on all fronts is to be commended. I thank everybody present today for their commitment and dedication to keeping Long Hill safe and healthy. So the initial goals of the task force were the protection of first responders through implementation of new response protocols. We also wanted to get a handle on contingency planning. As I said, procurement of PPE supply was paramount at that time, and we also wanted to establish information channels for education on best practices for social distancing and good hygiene, as well as keeping our residents up to date with the latest and most reliable local and national news on COVID-19. So I'm happy to say that these initial goals were quickly achieved. For example, in the first 10 days, all of our first responder agencies had implemented new shift plans, and they had response protocols to minimise exposure. And our town hall, although closed, had implemented remote working capabilities so that the township business would continue without delay or diminishment of essential services. So with good progress on initial goals, the task force was then able to turn its attention to other initiatives as the emergency expanded. So COVID-19, as we all know, impacts older age groups and immunocompromised individuals most severely. So as a township, it was our mission early on to maintain these at-risk groups at home as much as possible. So we established a community hotline for any resident to obtain assistance with such tasks as shopping for groceries or obtaining medications. Our township employees, working with our OEM group and the senior centre quickly embarked on a programme to identify our senior population, obtain their contact information, and then reach out to do telephone checks and need assessments. As positive cases were recorded in the township, we encouraged patients, their families, and close contacts to also avail themselves of the community hotline. In the next week or so, we will roll out another important mental health initiative to combat the feelings of isolation, loneliness, and anxiety that the crisis and the necessary response might engender. So the COVID-19 emergency really has tested the fibre of every community in the state. And Long Hill Township, on this its 45th day, I truly believe has made us even stronger and more unified than we were. I thank all the residents for their commitment to social distancing, and that's the only weapon that we have to combat virus spread. While other municipalities have been forced to close parks and other areas of passive recreation, we've been able to keep them open because of this type of commitment. I also thank our business community for their dedication to keeping their employees and us safe and healthy. In this regard, the employees of all our essential businesses deserve a special mention. They are there every day, packing shelves, checking us out, making home deliveries, and maintaining the high standards of hygiene. And it's all done with a smile and good sense of humour from what I've seen. Our debt of gratitude to our first responder agencies, that's police, fire, and EMS, is enormous. They don't have the luxury of staying at home to minimise their contacts. Instead, they man the front lines, putting our safety and our health uppermost in their minds. I also thank the many residents and organisations in the township who donated supplies, services, and even buildings to be used for the work of the task force. And I especially thank the scores of volunteers who, without being asked, really organised themselves and offered up assistance in any way possible, from making masks to collecting PPE for donation to hospitals, and also to work with our OEM group to address the various needs of, as I said, our at-risk members of the community. So I consider myself very fortunate to work with the people in this task force that I have over the course of the last 45 days, and also to be to be part of such a caring community. So as a format for today, what I'm going to do is I'm going to ask some of the department heads to discuss a little bit about what they've done in response to the emergency, and then with that I'll turn it over to questions from the residents, and also as I say, we're open to suggestions as well. So any comments or questions, suggestions are most welcome. And so with that, Nancy, I'll turn it to you just to talk about what we've done at Townhall.
Thank you, Mayor. As you said, we have been closed for 5 weeks, actually. 4 weeks on Monday will be when all the employees began working home, but the week before that, we excluded the public from the building. And that was for their health and safety, as well as our employees. But since we have been working at home, we're still providing all of the essential services that we're permitted to provide. Taxes, the tax deadline, May 1st, is still coming up. The state has not allowed us to delay that due date or the grace period due date. So taxes will still need to be paid in May. We're encouraging our residents to pay them online through our website. But if you need to mail in a check, obviously, people can still do that. We're still getting the mail. While we would not, we prefer that people don't pay in cash. We have to accept cash if that's the only way that people can pay. So we're asking our residents to make an appointment with the tax collector so someone can meet you there to accept accept cash. But if at all possible, we prefer that you pay online or by mail. We're still doing our fire and smoke detector inspections for people that are buying or selling house. They are issued by affidavit, so they would call town hall to make the appointment just like usual. Residents can still apply for construction permits. Inspectors are only doing at this time outside inspections or unoccupied houses. But inside inspections are being done by video and by photos. And residents would have to sign an affidavit as well. That information is available through our construction office. Planning and zoning board meetings were held by Zoom meeting, but for applications, most applicants, actually all applicants, have given extensions to this point because we would like to provide the public as much access as possible for these applications. So we're trying to hold off as long as we can to have hearings on those applications. The clerk's office is still processing marriage licenses. Any registrar certified copies have to be obtained through the state, through the link on our website. Dog licenses are still coming in and being processed. Our recreation department, all fields, courts, and playgrounds have been closed for some time, but the path at Cantor Park and the Hicks Tract are still open, and we request that people use social distancing if they're going to be out there. And so far, I believe that's happened. Residents have been very cooperative. It is unknown if or when Sterling Lake or summer camp will open. That's to be determined. And our rec department has put virtual rec activities on their webpage. They have yoga, they have a scavenger hunt. There are links to fun activities, so people can visit that page. The library has made available access to online books and videos as well. So visit the library page for that information. And DPW is still working as usual, although with revised scheduling. And our garbage carrier still collecting garbage and recycling, but has let us know that there will be no bulk pickup in either April or May as of now. But otherwise, we are, we're functioning. All of our employees can be reached at their regular extensions. We've got them access to all of their computers from home and to their phones that go directly to their cell phones.
Okay, thanks, Nancy. Thanks very much. Chief, if you'd like to tell us about the changes at the police department.
Sure. Thank you, Mayor. Good afternoon, everybody. Thank you for this opportunity to get you caught up to speed on what the police department has been doing. We, like the mayor said, and to reiterate, I believe one of the best moves that this town was involved in was the creation of the task force, which I believe occurred roughly 2 days after the first case, and got us on track or ahead of track. Regularly and daily, there's a morning conference with the state police, the regional intelligence center every morning, and hearing what the challenges that a lot of the police departments and a lot of towns are facing. I could report back that we are in a very good position and a very good situation based on our PPE. Equipment that we've purchased, including the UV lights, which I believe have been in use by all the first responders, the PD, the fire, and mostly really the EMS. But I can say here, in the challenges that everybody is facing, we are way ahead of the game, and really thanks to the task force for putting us in that situation. Aside from that, the police department did go on a modified work schedule, a hybrid work schedule, with no compromise or no effect to minimum manning levels. Our minimum manning has stayed the same as it was before the COVID-19 pandemic took place. We have since took advantage of a county-based online self-reporting system for It's a platform for residents to report low-level crimes, things of criminal mischief, credit card fraud, things of that nature. We've had a couple of residents use that, so it's been very helpful in the social distancing, and it's still available through the police tab on the website, on the township website. We have seen a little bit of a rise in crimes related to COVID-19 as it relates to scams or attempted scams of fraud, requests to assist the elderly, gaining their credit card information or trying to get money up front with no intention of going to do the shopping. We've seen a couple of thefts from mailbox as it relates to check washing, and now I guess the next biggest thing is going to be the people that are receiving stimulus checks in the mail. Now there's a concern of theft for that, so please be cognizant of your mail delivery and try to remove your mail as quick as possible. The couple of other pointers we have on our Facebook and we have on our website as far as the scams. If the residents could take to that for advice or call us if they have any concerns, we'll be more than happy to address that. Other than that, our call volume has been significantly lower. The officers have been detailed to ensure the executive orders are being followed. While it is challenging at times, we are seeing the vast majority of our residents and our businesses in compliance. There have been a few minor mistakes that were quickly addressed. And again, I think that speaks volumes for the numbers we're seeing in Long Hill Township and the work of this committee and this task force. I do want to thank everybody that's here today. Other than that, I don't have anything further for the police department.
Thanks, Chief.
Thank you, Mayor.
So Al, I'll turn to you for double duty to update us on fire and DPW.
Sure, thanks. I'll start with
As the administrator said, we did go to a staggered shift. One crew on one day, one crew off. They're working 12-hour days, including Saturdays for the time being. Everybody's healthy, practicing social distance as much as we can, depending on the work we're doing. We're fully equipped with supplies, PPE, selling a lot of mulch, so residents are still calling. The yard's been, never seen the yard so busy. I guess people are home. People are utilizing the yard for drop-off and recyclables. So everything is good on DPW. As far as fire, like you said, we did make adjustments when this started turning up. As far as scheduling and response to calls, limiting the response, and we are in very good shape. Listen to Chief Naga talk about some other surrounding towns as far as PPE. We really got ahead of everybody else around us, I think. So if anybody has any questions on the DPW side, they could call the phone number. Either myself or my assistant Danielle will pick up for mulch orders or any questions that residents might have.
Thanks, Al. So Shane from OEM, I know you've been busy over the last 45 days. So if you would like to, give us an update.
Thank you, Mayor. We've been in touch with many people in the community, but I do appreciate the opportunity to provide an update on emergency management activities. And I hope to hear from some of you later, either in the question period, or please reach out at any time to the department. From an operational standpoint, the department is doing very well. We're functioning well, albeit remotely. Our deputies are active daily, working on public communications, the COVID task force website. We review and respond to daily updates from our county and the state. Thank you, Lisa. A lot of that coming in. And we support requests generally from the residents for deliveries, registration for our alert Long Hill, connecting people with county services. So we are busy. It's good work. I think the department and the volunteers at large have really risen to the occasion. So I appreciate your compliments earlier, Mayor, and we look forward to continuing at a full force. So one of the many things we have are the benefits of the deputies. I think I had a little trouble hearing Chief Gallo, but he has done a stellar job of ensuring that we have our disinfectant products and our PPE supplies for all the administrative, the public safety, and the DPW departments. So thank you very much for that. We do meet weekly, I think was mentioned earlier, as a task force. We also conduct meetings daily as an OEM department. We update each other and we create a situation report for the team. We are in constant contact with our partners at Public Health. Thank you, Caitlin and Lucy. We are checking in on seniors and group homes with particular interests and our residents with special needs and concerns. The LHT CERT team and the MRC are active locally and at the county. They are tasked daily with deliveries for our high school free lunch program. They are providing hotline support. They assist in many administrative tasks for OEM. Many of the nurse volunteers, by the way, again, are active at the hospitals. They are employees at Memorial and Overlook. I'm very busy with that, but the several nurses we have locally are busy at work with supporting fit testing needs earlier this month, and they are manning the call centers up at county. I have just a couple quick announcements, if I may. I spoke with Michelle, the manager at ShopRite, and she asked me to share the following. Her store hours will be adjusting this weekend. She will be closing at 2 o'clock on Sundays. That is for the next 3 Sundays, and they may extend that as needed. The senior hours have been posted as 7 o'clock, but they are actually open at 6:45 until 8 a.m., and they're going to continue on with that indefinitely. She asked that I extend her appreciation and thanks to the patrons. They've been complying very well with the masks. They've had no issues with that. And the social distancing is going pretty well. A couple other updates with regard to food pantries. While we've had very few requests, I just want to remind the community that we do have food pantry items available. It's a simple call to the hotline or the Office of Emergency Management. We're in touch with the All Saints and Father Richard at St. Vincent's, and they have adequate supply to meet any requests at this point. County services are still fully operational. Our seniors and other members of the community are receiving their Meals on Wheels. We also have a nutrition program, which is maintaining operationally with home deliveries twice a week for our seniors. From Linda Olmstead, she's been in close touch with the senior center. She reminds everyone while the senior center is closed, there is an administrator there working to monitor for phone calls. So please call in with any needs. And they are also doing outbound calls, and they're very in touch with their seniors. From Larry Fass, we have a steady stream of efforts for the communications. So thank you for the Facebook posts. And I know he's been working with you, Mayor, pretty closely on those messages that you've been sending out weekly for the public. We thank you for that contribution. Last, Lisa Scanlon has been maintaining the COVID task force website page for us diligently. We encourage all the residents to continue to monitor that. There's a plethora of information there for everyone, and it is updated daily. If I could turn to Lisa for a quick update. I think she has a couple other things, Mayor, for OEM for us.
Okay, very good. Thanks, Shane.
Thank you.
Lisa, you're on.
Okay, gotcha. I had to figure out how to unmute myself. As you mentioned, Shane, we are doing a COVID-19 page, which is linked to the front page of the website. In addition, I've been tracking the meetings and maintaining minutes of all the meetings that we've been having, as well as serving as a collection point for information that's been coming in from all avenues that we receive and cataloging it by day as we receive it. We monitor a lot of different websites for information, and anything that we post on the COVID-19 page is information that we feel is from very reputable sources and has been thoroughly vetted. So I encourage our residents to continue to go to that webpage on the website. And that's it for me, unless anybody has any questions for me.
Thanks, Lisa. So, Bob, if you could tell us what the things that you've done at the squad. You're on. Bob's on mute. I think you're on mute, Bob.
There we
I
go.
see. Yep.
Yeah, thank you, Mayor. We are open 24/7 as always. The call volume has gone down over the last 2 months, which is good. We have plenty of protective gear. Thus far, we've transported 3 COVID-19 patients to the hospital, and I know there's probably about 31 or so patients in town that we're monitoring. I just want to mention also, if you do have flu-like symptoms, I suggest that you might want to call your primary care doctor first, especially if they're kind of minor, rather than call 911. The Department of Health is trying to encourage people to stay out of the hospital if they can. So if your issue can be treated by your primary care physician or perhaps an EMO, you might want to start there. But if you feel it is serious and you do want transport to the hospital, don't hesitate to call us. Now, normally when we have a call, we'll have 3 or 4 members on a crew, but we're trying to minimize the number of members on our first aid crews. So typically you'll only see 2 people show up now, and we'll have full protective gear. We're treating everybody as if they have the COVID-19. So we'll have our masks and goggles and gowns on when we come to your house. We might ask you also to walk to the front door if you can, and if you can't, that's not a problem. We'll come in and get you. And after the call, to the hospital, we come back and we scrub down our ambulances. Our ambulances have never been so clean, I'll tell you. And then we hit them with the ultraviolet light 2 or 3 times. So we're ready if needed. So all in all, things have been going very well. We have plenty of staff members. I also appreciate the donations from the town. Just the other day, we got a crate of oranges at our back door. I have no idea where they came from, but thank you very much, whoever that was. We've also been getting face masks and treats periodically at our back door, and they're all very much appreciated. Thank you.
Thanks, Bob. Caitlin, for for public health, if you could, I know your department is extremely busy. You're kind of the focal point for many things at this, many activities during this time. And thank you for joining us today. But if you could give us an update of some of the things that you've been doing.
Hi, thank you, Mayor. For those of you that don't know me, the residents, my name is Caitlin Cartocchio. I'm a health educator for the Bernards Township Health Department. I'm speaking on behalf of our health officer, Lucy Forgione. So the Bernards Township Health Department, we cover 6 towns and 2 counties, both Somerset and Morris. So I am serving currently as the Long Hill Township liaison. So I've been working with the task force since the beginning. The health department itself closed to the public on March 16th, but we've still been working here. This is not my home. I am currently in the office. We are staggering our staff, and we're only seeing the same 2 or 3 people every couple of days. But we're pretty much working, as the mayor mentioned, we're all working pretty much constantly. So since the beginning, we've been actively monitoring CDC, the WHO, working with the Morris County Office of Health Management. We want to make sure that anyone that we're working with gets credible and up-to-date information, both the task force, any of our local officials, and of course, residents. We want to make sure that you guys all have the correct information. This is a time when a lot of rumors can fly and information can kind of seem very overwhelming. We want to make sure that what we provide to residents is accurate. So in the very early days, it was mainly residents calling and asking questions, and that has slowed down significantly, I think because I want to say because of the task force getting that information out to residents so they don't need to call in as much. Before many of the businesses closed, the health department was giving guidance to places like grocery stores, pharmacies, private schools, helping them talking about cleaning and disinfection. But the majority of businesses have closed at this point. So, but if any of the currently open ones need guidance, they are free to call the health department with questions. The health department follows and tracks all Long Hill Township cases, all cases that we cover in all of our towns. The Visiting Nurses Association is the one who's responsible for the contact tracing. So what contact tracing is, long story short, is anyone who is confirmed positive, we give them a call and we talk to them and we ask them who they may have had contact with when they were either symptomatic or asymptomatic, just so we can talk to people who may have possibly been exposed so they know to monitor themselves for symptoms. I've been sending out bi-weekly updates to all of our community partners. I think today, I have it currently on my screen right now. It's going to be update number 16. These are just little sheets with current testing information, numbers for Morris County, numbers for Somerset County as well, links to applicable New Jersey COVID-19 related sites. And then every update, I kind of designed something new that people are asking questions about. So a couple weeks or a week ago, when the face coverings were the big topic, I made sure to include information on wearing face masks properly, what they should be used for. So again, to see those updates, those are on www.bernardshealth.org. As the mayor mentioned, mental health is going to be a big concern. It currently is, and it will be in the coming months. This is a passion project to me as well. Mental health is very important to me. I put together a mental health resource guide specifically for COVID-19. It includes both mental health information as well as substance misuse. Anything that I could think of, I put on the form, and I'm going to keep updating it as more information comes out. We also have a local resources guide, and Long Hill Township has a lot of great resources to add to that. Currently, it's one page. It's probably expanded to because of all the amazing resources that are available in all of our towns. I've also developed many health education handouts. So I mentioned in the beginning, I'm a health educator. So my real goal in all of this is to educate the public properly about COVID-19, about any health issue in particular. So we did a variety of handouts in the beginning, and we make sure that residents can get access to those. We've been checking in on, this goes for all of our towns. We've been checking in pretty closely with all of our long-term care facilities and group homes, anywhere where there's congregate housing. These are very at-risk populations right now. We want to make sure that everyone's doing well and that all of those locations are abiding by, they're doing temperature checks, they have the proper PPE to make sure that everyone living there is safe. In terms of our health department, so again, I mentioned health education. Any of our upcoming programs did have to be canceled. We hope to reschedule, and our focus has obviously been on COVID-19. We're still providing all of our essential services in the health department. We're not doing food inspections at this time, but if there are complaints about any businesses that are currently open, we are taking those over the phone. Environmental wise, we're still doing soil logs and septics if necessary. A lot of construction has been put on pause, so that's been a bit slower. And all employees have their phones extended to their cell phones. So if anyone needs to reach us while we're out of the office, we can pick up on our cell phone. So even though we are closed, we are still here for residents, and we want to make sure that everyone knows that we're still here. I think it's a time of uncertainty, but I want everyone to know that both the task force, your local health department, we're all really we're here to take care of you, and we want everyone to be safe as possible during this time. That's all from me.
Thanks very much, Caitlin. So with that, last but not least, I'll turn to Ed. Ed, you've been in this from the beginning with the closure of the schools, and so if you could just give us an update of what you've been doing for the students, as well as any future plans you might have for opening if there are any.
All right, sir. Thank you. Thank you, Mr. Mayor. Hello, everyone. We've been closed basically since March 16th. This is the fifth week that we've been closed, and actually it's been 4 weeks of home instruction with our students and their parents. We're working as best we can in a remote situation with our students. It is not ideal. We recognize that, but our staff, I feel, has done an excellent job in stepping up their game and really being involved with the students directly as well as with the parents. So we appreciate everyone's patience. Today, as part of my weekly update to our parents, we will be sending out a survey to our parents as well as to our staff to see how we can better assist our instructional program and support our teachers. We are certainly working closely with the Department of Health. Caitlin, thank you very much for all of your support. And basically, at this point, we are relying on directives from the governor, who yesterday indicated that we would remain closed until at least May 15th. We will be having a Board of Education meeting on April 27th. It will be a Zoom meeting that will be open to the public. That is also the evening that the board will be approving the final budget. So we will have dial-in information as well as Zoom information for anyone who would like to attend. And that's basically all I have at this point.
Okay, thanks, Ed. Thanks very much. We have two of my esteemed colleagues on the Township Committee present with us. Guy, if you want, I know you've been busy. If you wanted to say a few words about what you've been up to.
Thank you, Mr. Mayor. And if I could, I want to thank Shane, Linda Olmsted, and Lisa Scanlon, because to be fair, they do the heavy lifting. We stay in touch with a lot of groups, but it's almost too much information. So what I do is I forward it to Shane and to Linda and to Lisa, and then they filter through it all, and then they put what is necessary. But just to give an idea of who we're in touch with, of course, first and foremost, the governor's office and his team, which have been remarkably forthcoming with information. And we get it just a little bit before the governor's daily press conferences. So that's helpful to us. It gives Lisa and Shane and Linda time to get that information and filter through it. But also the New Jersey League of Municipalities, the Association of Counties, the New Jersey Chamber of Commerce, the Morris County Chamber of Commerce, our state elected officials like Senator Kane, Assemblyman Bramnick, and Assemblywoman Nancy Munoz. All of these groups give daily updates. So the information is sometimes duplicative, but not always, which is why it becomes tricky. You've got to go through the information and see and pick and choose, and hopefully you don't miss anything. Also, the regional director of the SBA, the Small Business Association, the NJBIA, the New Jersey Business and Industry Association, and Somerset County, because obviously we are in many ways, if not most, closer geographically and in some cases business-wise to the Somerset County Business Partnership. So those groups give us information at least once a day, sometimes multiple times. So there's an awful lot of work that goes into reviewing that information and then filtering what should be released to the residents of Long Hill Township. So again, I'll end the way I started. Thanks to Shane and Linda and Lisa, because they have to filter through all of that information and then get out to the public what is relevant to Long Hill Township. So thank you, and I turn it back to you, Mr. Mayor.
Thanks, Guy. And it's the irony is not lost. I mean, here we are in the past emergencies that we've had here in Long Hill Township. We've held these types of meetings to provide information because nobody's been able to get any. The internet's been down, or other sources of communication, and then here we are in this one. Literally, as you say, it's information overload, and so it's good to have a team kind of being able to look at the information that's coming in and filter it and get the most relevant to the up on the website and communicate it to the residents. So Randy, you're there. I see you. Thanks for joining us. For anyone who doesn't know Randy, Randy's our Chief Financial Officer, very important person in the township. So Randy, would you like to add anything to what's been said in regard to what you're up to in your department?
Thank you, Mayor. We're operating as usual. It's sometimes it gets a little hectic when you're working remotely, when government is all about paper and so forth. But maybe one good thing, we'll streamline paper in the future. That's certainly a possibility of how we're doing things currently. I think Nancy hit all the points as far as tax collection and so forth. And just to reiterate, if somebody does want to pay cash, while we try to encourage them to pay online and through the mail, or a drop box at the municipal building that's on the wall by the side entrance, we will make an appointment to see them if they want to pay in cash. Other than that, Mayor, at the office, finance, payroll and taxes are all working smoothly, and we're there for the residents if they need us.
Thanks, Randy. Lieutenant Chambrello and Lieutenant Marcheski are both here with us, and I know they've been very, very, very busy keeping up with all the executive orders that have been coming down and the changes that they bring to the workings of the department, and so working very closely with the chief to keep the police department moving forward and in the right order as far as the governor's orders. I don't know if either would like to add anything at this point to what the chief had mentioned in regard to the police department.
I don't have anything to add, Mayor.
Okay.
I don't either.
All right, thank you. So with that, Nancy, I think it's this is such a unique, or up until now, it's a very unique opportunity with all of us sitting here, around our computers, live and able to take questions and comments. And so, if you'd like to open it up to the residents for any questions or comments or suggestions.
Yes, Mayor. So we currently have 52 attendees on the call. 11 of them are by phone. So for the residents who are on through their computers, there's a raise your hand feature next to your name. For the residents on the phone, if you press *9, if you want to ask a question, that will serve the same purpose and will raise your hand for me to see. We do have one, we have several coming in. So just leave your hand raised until I call on you. Mayor, just so you know, we are streaming live on Facebook and YouTube right now. So there's a lot more people that are watching than are actually on here. What I'm going to do is I'm going to unmute the people who've raised their hands, and then Mayor, you can direct the call, the question to whoever you'd like to answer.
Okay. Thanks.
The first one looks like Pam Ogans. Go ahead, Pam.
Am I unmuted?
You are.
Okay. Just a couple things. I wanted to thank the mayor personally for hand delivering my package that was dropped off incorrectly at the firehouse. So thank you, Mr. Mayor, for that.
You're very welcome.
I also want to thank Shane and her group for the outstanding job that they're doing. I am a senior. I don't live alone, but I did get a phone call, which was very much appreciated. We're in good shape, don't need anything, but certainly phone call was reassuring. I want to also thank you all for in conjunction with the planning board, understanding that applications to the planning board are being held off. Zoom is not perfect, and certainly there are lapses in audio, and it's appreciated that those applications will not be heard before the planning board until a more accessible to the public time. And my last thanks is for keeping Hicks Track open. It certainly is a big benefit at this time to be able to go out there and walk. And I agree with you, people are being very respectful of socially distancing. And I hope that that continues to be sort of a release valve for us who are stuck home but need to get out and get some fresh air and exercise. Once again, kudos to everybody. It makes me very happy and proud to be a Long Hill Township resident.
Thanks, Pam. Thank you.
Okay, Mary, next we have Roseanne. Roseanne, you might be muted on your own.
I think
Okay, go ahead.
I just want to thank Mayor Ray for his audio updates we've been getting on a regular basis. It's very reassuring and quite calming in these anxious times. And I want to thank Shane Daly also for keeping in touch with the members from CERT and MRC. That's about all I have to say.
And we're following the New Jersey guidelines, because where we are now, people are not following the guidelines, and they keep saying, where do you get your information from? I said, well, my mayor calls me and sends me emails about once or twice a week, and I'm following the New Jersey guidelines. So I appreciate that.
Thanks, Roseanne.
Great job, Ray.
Thank you.
Okay, next is Jim D.
Dell'Orficio, Jim Dell'Orficio. Hi, everybody. I'm a member of the Long Hill First Aid Squad. I actually have two questions, and I think they probably will be best directed to Caitlin. Number one is, do we have information of all the people who we know are COVID positive? Do we know how many have actually recovered from this? I think this is important for our squad to know, to see what we're up against. And if the mayor could put that into his weekly update, I think it would offer a lot of hope for people to see that this is not necessarily a fatal thing. That's my first question. And my second question has to do with the serological tests for antibodies. If they get that test, as a member of the squad, I would really like to be able to take advantage of that. I was very sick at the beginning of the year, and I may have had this already, I don't know. But I would go into a call with a lot more confidence if I thought I had antibodies.
So for the who's recovered, I'm gonna ask my health officer about that, because I don't currently have that information. What we do is when we monitor cases, or when the nurses help us monitor these cases, we check in with them over the course of 2 weeks, and we keep on checking in with them until they're considered recovered, and then they leave our system. So as for reporting who's recovered, I will look into that, and I will ask the health officer. And as for the serological test, I completely understand what you're saying. I was sick myself at the end of last year, and I'm always wondering. But I understand, as a member of the First Aid Squad, you would feel more comfortable going in if you knew you were more immune to it. For right now, I believe they're only testing people who had confirmed COVID-19. But if that does change in the future, that would be something in particular I would put on my update, and I would make sure the task force was aware of that, and that information would get out to whoever needs it. Because I agree with you. I think that's going to be very important in the future for people to know whether or not they've had it, prior to it becoming more public knowledge. So, end of January into February when this first started being reported. I think it'd be very interesting to see that.
Okay, thank you very much.
Thanks, Jim.
I don't see anyone else.
No? Call up the Zoom
Oh,
bombers.
wait. No, there's another. Here's someone, Catherine Black. Go ahead. Catherine? I think you have to unmute yourself because you're unmuted here. Maybe she didn't mean to raise her hand.
Okay, and that's it for comments or questions. Nancy?
Wait, it looks like no. Yeah, I think that's it.
Are anybody on the phones? That's we've covered them as well.
If they have a question on their phone, press *9. We do have one more, Gary and Joyce Pratt. Go ahead. Go ahead.
Okay, thank you, Nancy. Joyce and I just wanted to echo the
Wait. You there?
I'm here.
Okay, sorry.
That's okay. Joyce and I just want to express our thanks for everything that township employees are doing, just everybody. We've been really impressed with what's going on, and we really appreciate making this information available to us and giving us access to meetings like this. So just thanks to everybody.
And I would like to add that the mayor's calls sound, they're just very professional and very calming. I heard someone else say that. It's just very calming, and it makes you feel a little bit more confident and hopeful that we're going to know what's going on and make the right decisions for our own selves. And it's wonderful job, everybody. Thank you so much. And we're very proud to be part of this town.
That's great. Thank you. Thank you both very much. Nancy, are we good for calls?
We are. Just want to say again for the people on the phone, if you press *9 if you want to talk. Nope.
No.
Nobody else.
I was in such a rush to get to the questions and comments, and the one person I didn't call on just to ask about what was going on with their departments. It was you, Megan, as far as the clerk's office. Do you have any updates for for any of the activities that are going on there?
I just received something from the state that the liquor license renewals will be extended until September 30th. And just a lot of things are being extended now. I've had a few people call about marriage license applications, but nobody's really set up an appointment. Other than that, just business as normal as it can be, working from home. So.
Okay. Good. So Nancy, I guess no other comments. So that's probably, that could very well be a good thing. It means that things are moving along smoothly. So with that, I'd just like to, again, thank everybody. Oh.
We have a last minute caller. Oh no, he put his hand down. Wait, come back if you want to talk. Here's somebody. It might be Fred Rossi. Fred? I can't unmute him for some reason. I think you have to unmute yourself on your side. Fred, I can't unmute you. We have a few calls now, a few hands up, but I can't unmute Fred. I think it's on his end.
Fred, if you go into the bottom left-hand corner, is there a little microphone that says mute? If you click that, it might unmute you.
Mayor, do you mind if I promote him to it? Oh no, I think you got it.
Yep.
Okay. Fred, go ahead. Fred, are you there?
No. No, I don't think so. Like back on mute.
I think Fred put himself on mute. So,
Okay.
Okay, so we'll move on to the next person. Gino. Go ahead, Gino.
Can you hear me?
We can hear you.
Okay. I had written an email questioning the taxes and the sewer bills not being pushed forward. We just got information that even our car insurance is going to give us some money back because we're not driving. Can something be done about the sewer and the tax? I heard you said the state didn't allow that. What can we do?
Randy, do you want to take that?
Yeah, Nick, I'll take that. The state law gives us the amount of grace period that we can go to the maximum of, and each quarter that's a 10-day grace period. The due dates for taxes are set by statute, so that those are due in the middle month of each quarter: February, May, August, and November 1st. However, with that being said, there was legislation that was passed by the Assembly to allow an extended grace period for this quarter. It went to the Senate. The Senate made some tweaks to it, and it's now back in the Assembly. I'm under the understanding that early next week, when the Assembly meets, that they may very well pass it, and the governor will more than likely sign it. I don't think there's any downside to it. It is permissive to each municipality, so they will be able to extend the grace period to whatever period up to the maximum that the state would allow.
Thank you.
So,
Thank you.
Gino, does that answer your questions?
Can you hear me? I'm saying thank you.
Oh, okay.
Okay.
Thanks, Gino.
Thank you. Okay, we had William keeps raising his hand, but then lowers it. So William, if you have a question. Nope, doesn't look like anybody. Anybody else?
Nobody else?
Oh,
Okay.
yeah, no, that's it.
All right. Well, with that, once again, I thank everybody for taking time out of their busy days and schedule to gather around today. I think it was important that we had it all. That we all gathered here together just to kind of recap where we are in our response and also get some feedback from the community. So thanks thank you for that, and I think we can terminate the meeting. Nancy,
All right, thank you.
adjourn. Thanks, and thanks to all the residents as well. Thank you.